Good morning, everybody. My name is Jakub Chwiećko. I'm a pediatrician and former K.I.D.S Foundation medical director, as well as business creation lead for EIT Health, not anymore. But it's my pleasure today to greet you at the Pediatric Innovation Day, where we're going to have the whole day of experience with the medical innovation in pediatrics. So welcome everybody here together with us, but also people joining online. Just to make sure, people who are online have the cameras and microphones turned off, but you can actively participate by asking questions in the Q&A, which will be moderated as well. We have the local agenda and coffee on the side, so everybody who's going to be willing to have some coffee, please do. And to start with, we're going to identify ourselves with the badges. So you probably see that the badges have different colors. We have the badges of organizers, which are red, badges of speakers, which are purple. I actually don't have one. The wildcard startups, which are blue, and the last one, participants, which are yellow. We invite everyone to join our online community as well. You can find the QR code at the back of your badges. And for those people joining online, you have the QR code here, so please join our community and stay connected to us. Today's event is organized by many kids. There is I4Kids, I4Kids Europe, and it's hosted by K.I.D.S Foundation, which is Children's Hospital Innovation Club. This will be a full day of exciting events. We have almost 20 speakers and panelists, 7 wildcard finalists, and we will have one-to-one meetings, investors for startups, and workshop for kids. Let's give it up for all the people here in the room so they can feel we have started something incredible in Warsaw. Right here you have the partners of I4Kids Europe Consortium. There is a hospital, San Juan de Deu. There is a long name for the foundation of San Juan de Deu in Spanish, which I won't pronounce. Sorry for that, guys. We have the Inveniam. We have the BUKS, which is a children's clinical university hospital in Riga. We have the regional Hovnestadt from Denmark. We have HUS, which is Helsinki University Hospital, and EIT Health Spain, as well as K.I.D.S Foundation. Of course, this event wouldn't be possible without the sponsors, which are Siemens Healthineers and PALI European Institute. The sponsoring partner is Publicis as well, which is not in my script, sorry for that. And of course, our honorary patronate of Children's Memorial Health Institute. Another patrons of the event, Institute of Mother and Child, University Children's Clinical Hospital named after Ludwig Zamenhof in Białystok, which graduate Amen. Institute of Healthcare Management, Łazarski University, Coalition AI in Health, and Polki in Medicine, which is female doctors in medicine. Today's event is also endorsed by Rynek Zdrowia and Rzeczpospolita as media patrons. And of course, this project is made possible thanks to the funding of European Union. Starting with our team today, we gather here to talk about when imagination meets healing. And to unlock this magical pediatric innovation together, we're going to open this session with Karolina Sielska-Bielska, the K.I.D.S Foundation president, Arnau Valls, esteemed coordinator of innovation, Sant Juan de Deu, Barcelona Children's Hospital, coordinator for I4Kids and director of I4Kids. Many names, welcome. and my former boss, Magda, Krakowiak, the Director of Business Creation, EIT Health. This is my microphone, and I don't know where is yours, because it should be here.
Thank you, Jakub, and welcome everyone. We are really excited to be here in this Pediatric Innovation Day. So good morning, and on behalf of I4Kids and Sant Joan de Déu Barcelona Children's Hospital, welcome to the third edition of the Pediatric Innovation Day, the first held outside Barcelona in a colder environment, let's say. First, I would like to thank K.I.D.S Foundation, and especially Paulina, Karolina, and all the team for the amazing work that you've been putting out and hosting today's event. Also, Michael, Jakub, and Dr. Magda for the hosting of yesterday and showing us the health innovation ecosystem in Poland. Also, Magda, Maria, and Celia for the co-host and organization of the big finale of the wildcard that we will have today. And let me say few words about I4Kids before starting. I4Kids was born in 2020 in Barcelona with the aim of tackling the lack of medical products on the market for maternity and infant care. In short, our mission is to foster and promote innovation in pediatrics and maternity field for a better health and well-being of the small ones and future societies. So in 3 years, the I4Kids have already accomplished a great deal, counting with 64 members, 30 associates, and more than 30 associate entities, 92 research groups, mentoring 22 projects to advance in their developments, thanks to the valorization and acceleration programs, and has promoted and provided 125,000 euros in grants to help this project advance. Also, we've trained 500 innovators in innovation specifically for pediatric and rare diseases. During these years, one of the 3 projects that we are more proud and we think that will have more impact are, first of all, the collaboration in the I4Kids Europe that we've just started this year to try to foster on the experiences and the expertise around European pediatric hospitals around Europe to help advance in bringing new products and new solutions for the diagnosis and treatment of the small ones. The second one is an initiative that we've been collaborating to create the first Pediatric Impact Fund in Europe together with Ship2B, and that today we will have the Managing Director, Mar Ramis, who will be presenting the results and how is the innovation and investment ecosystem nowadays in Europe. And third, and not least, to be partners of the EIT Health in this wildcard program focused in child health that has been really a great initiative and learnings and helping accelerate 16 projects and participants and 7 finalists. Really, I'm really looking forward for today's speeches in this big finale, and I hope the best for all the participants. Finally, the I4Kids Europe project and the I4Kids have lots of different entities and innovators that have participated and that are here together with the common aim to make child health and the child have a better future. I see all these initiatives as a cradle for pediatric innovation, leveraging this different knowledge and expertise with the purpose of innovating to ensure that each child have access to the best diagnosis and treatment, as we said. So again, thank you very much, and I hope that today it's going to be a great day for starting these innovation, new initiatives and these innovation collaborations. So I pass the word to Karolina from I4Kids Foundation.
Hello, thank you very much. This is a very big pleasure for me to welcome all of us to Pediatric Innovation then in Warsaw. We are a foundation, Children's Hospital Innovations Club, and I will say something more about us. We have a mission. The more important thing for us is join the forces to create hospital of the future for children and for all of people who care about them. So we are competence volunteers, all of us. We are business leaders, we are parents, we are people full of passion to change this patient experience. We decided to support this transformation. We cooperate with over 50 hospitals and healthcare units of Poland right now. And most of our projects is connection with patient experience. I would like to say that it's, I would like to say it's a very big thing for us to have all of us here in Warsaw. And I hope that today's meeting will be full of energy and inspiration. Just take care this time. Thank you.
Great. So let's see if we can handle the slides. No, the technology is getting ahead of us. Right. Good morning, everyone. And I would like to say welcome to Warsaw. I know that Jakub already said it, but I mean, as a fellow Pole, I think it's not very often that we actually are present as EAT Health here, at least from the central perspective. So I'm really glad to see so many faces and people from across Europe actually joining this event, and we're very happy to be here as well. So of course, I would hope that most of you around the room know a little bit about our organization. So we are a public-private partnership that is essentially has been established by and is supported by the European Union in order to foster innovation in healthcare, because we have a lot of great pockets of innovation across Europe, but our mandate is essentially to connect them and to make our continent a little bit more competitive and essentially answering the massive challenge of healthcare that our population is facing. So not specifically in, so of course I could tell you we are present in 8 different regions, and I could tell you all about our projects and so on, but I wouldn't be able in 5 minutes to tell you much about that you cannot read or that we cannot follow up in a conversations later on during the day. So instead, I thought that I'm gonna reflect about what EAT Health is doing by drawing a metaphor between EAT Health's work and actually riding a bike. So could I have a show of hands of the people who know how to ride a bike? Good. It's almost everyone, or some people are attending to the emails. Right, so we know that the feeling of riding a bike seems very familiar, right? And if we think about how a bike is built, there is a back wheel that is sort of providing the let's say, the push. And then there's the front wheel that is sort of guiding the road. And it is very important to have a balance between the two. So I would like to draw this metaphor to actually innovators and technology and essentially all the scientific discoveries and everything that is happening around healthcare as being, you know, the back wheel, right? And it is very important that this back wheel is not providing too much of a propellant to the front wheel, because then it's very easy to actually lose balance. So EAT Health as a framework is sort of connecting the two. So the front wheel being the needs-driven innovation, very much connecting to the patients, working with the healthcare systems and so on, who should be guiding this innovation process. But EAT Health is sitting somewhere in the middle, like you may say a chain, that is making sure that both stay connected and that we can move at speed, that we can keep the balance, and that we can essentially enjoy this exhilarating ride. So speaking of which, you know, some people may say, well, we are actually a training wheels, but I don't view our role as such. We do support innovations, we do support entrepreneurs, we do support the technology development, but we very much stay in touch with the healthcare systems, the healthcare providers, and so on. And that's why we're very happy to be here and actually collaborate with San Juan de Deu in this Wildcard Challenge and the Wildcard project, and of course beyond. So very much looking forward to the rest of the day. And yes, please enjoy. Thank you.